Okay.
This is our presentation over mental health, and it's what it is and how we can get involved as a community. Mental health. Mental health involves our emotional, psychological, and social well-being as a whole. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make daily choices. Mental health is important at every stage of life, from childhood and adolescence all the way through adulthood. Bad mental health is considered the inability to cope with daily stress or abnormal emotional, psychological, and social well-being. Some statistics of mental health. 1 in 5 adults in the U.S., or 18.5%, experiences a mental health illness in a year's time. 1 in 25 adults in the U.S. experience a serious mental illness in a given year that substantially interferes or limits one or more major life activities. And 1 in 5 youth aged 13 to 18 experiences a severe mental disorder at some point during their life. For children aged 8 to 15, the estimate is 13%. Some of the mental health illnesses and disorders are depression, which is also called clinical depression or major depression, anxiety, bipolar, eating disorders like bulimia and anorexia, PTSD, and schizophrenia.
So the first one we will start with is depression, a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Depression causes feelings of sadness and or loss of interest in activities you once enjoyed. It can lead to a variety of emotional and physical problems, can decrease a person's ability to function at work or at home. Some symptoms of depression is feeling sad or having just a down in the dumps mood, loss of interest or pleasure in activities once enjoyed, changes in appetite such as weight loss or weight gain, trouble sleeping or sleeping too much, feelings of worthlessness or guilt, difficulty thinking or concentrating, and thoughts of death or suicide. So treatment options for depression is regular exercise, psychotherapy or talk therapy, medications, and electroconvulsive therapy as a last result. Okay, and the next one I'll be talking about is anxiety. Anxiety is a normal reaction to stress, can be beneficial in some situations. It can alert us to dangers and help us prepare us to pay attention. However, anxiety disorders differ from the normal feelings of nervousness or anxiousness. It involves like excessive fear or anxiety. Symptoms of anxiety would be extreme or intense fear of different situations, avoiding different situations, increased sweating, heart rate, breathing rate in certain situations. Muscle tension can lead to panic attacks. Some treatments of anxiety would be stress management techniques, medication, psychotherapy or talk therapy, cognitive behavioral therapy, and some medications. Again.
Meditation was the first one.
Meditation was the first one, sorry. Okay.
So the next thing we're going to go over is eating disorders. There are many different kinds of eating disorders, but we're going to go over the 3 most common kind, which is anorexia nervosa, bulimia nervosa, and binge eating. Most eating disorders derive from a distorted self-image problem. They look in the mirror and see something that isn't true. Risk factors are having a relative with an eating disorder, being a perfectionist, body image dissatisfaction, anxiety, people that are being teased or bullied, especially about weight, or a history of trauma. The high-risk groups for eating disorders are adolescents, especially 12 to probably 22, women, athletes, and women with diabetes. Anorexia nervosa is an eating disorder that is characterized by excessive weight loss caused by self-starvation and excessive exercise is what that's supposed to say.
Oh.
That's not, I probably put it wrong. and excessive exercise. Signs and symptoms are people who have negative feelings about their weight. They have feelings of being overweight. They do excessive calorie counting. A lot of times it's 400 or less calories per day. Excessive exercise, extreme thinness, and an intense fear of gaining weight. They are constantly thinking about their weight. Physical signs and symptoms are thinning of the hair and nail, lethargy, growth of fine downy hair all over the body, dry yellow skin and hair, and in severe cases, infertility. Bulimia is a chronic cycle of binging and purging in order to achieve and maintain an ideal weight. Binging is where they just eat excessive amounts, and then they either use laxatives or other resources to throw it up or poop it out.
Yeah.
Signs and symptoms of bulimia is a chronic sore throat from the acids, severe dehydration. A lot of times there's electrolyte imbalances, worn tooth enamel, and gastric reflux. People with bulimia nervosa are hard to tell just by looking at them a lot of times because they have a normal body weight or just slightly under. Binge eating is repeated episodes of eating unusually large amounts of food without purging. Signs and symptoms are eating a large amount of food in a short period of time, eating even when you're not hungry, eating past the feeling of fullness, eating extremely fast, and being ashamed of your eating habits. A lot of times they don't want people watching them eat because this is a clear sign. Anorexia can cause damage to structures and functions of the heart, increasing your risk for heart failure, and can lead to death. It causes infertility. Gastric rupture can result from bulimia. High blood pressure, type 2 diabetes, and sleep apnea are also common problems with eating disorders.
Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, or behaves. People with schizophrenia may seem like they have lost touch with reality. Although schizophrenia is not as common as other mental disorders, the symptoms can be very disabling. There are 3 different symptom categories, which are the positive symptoms and the negative and the cognitive. Here you have the healthy brain, which is all green, which is like the low level of activity, and people with schizophrenia have like a lot of red, which shows there's too much activity going on, and they can see things, even smell or hear things that are not actually there. Some positive symptoms will be like hallucinations, delusions, thought disorders, and movement disorders. Negative symptoms are the flat affect, which is the reduced expression of emotions on their face, reduced feelings of pleasure in everyday life, and difficulty beginning and sustaining activities or reduced speaking. Cognitive symptoms are poor executive functioning, which is the ability to understand information and use it to make decisions. Trouble focusing or paying attention, problems with working memory, which is the ability to use information immediately after learning it.
All right, post-traumatic stress disorder, or PTSD, is, according to the National Institute of Mental Health, PTSD is a disorder that develops in people who have witnessed or experienced a shocking, scary, or dangerous event. I know with PTSD, I mainly think of our veterans, and I think that's probably a pretty common thing to correlate with PTSD, but veterans aren't the only people that experience PTSD. Anybody that goes through a traumatic event could come out experiencing PTSD later on. Some just interesting facts about PTSD. About half of the U.S. adults will experience some type of traumatic event in their lifetime. 1 in 11 people will be diagnosed with PTSD, and women are twice as likely to be diagnosed with PTSD. And according to the National Institute of Health and the Veteran Affairs, as far as our veterans go, 31% of the Vietnam veterans, 10% of the Gulf War or Desert Storm vets, 11% of the Afghanistan War, and 20% of our Iraqi war vets all experienced PTSD after coming home. So some of the symptoms, there's actually 4 categories of symptoms. You have re-experiencing, arousal and reactivity, avoidance, cognition, and mood. Those are your 4 categories of symptoms. Some of your re-experiencing symptoms are flashbacks, nightmares, frightening thoughts. Your avoidance symptoms are avoiding places, events, or objects that reminds the client of the traumatic experience. Avoiding thoughts or feelings related to the event. Your arousal and reactivity symptoms, easily startled, feeling tense, difficulty sleeping or insomnia, angry outbursts. Some of your cognition and mood symptoms would be negative thoughts about oneself or the world, distorted feelings like guilt or blame, loss of interest in enjoyable activities. And in order to actually be diagnosed with PTSD, you have to experience at least 1 re-experiencing symptom, 1 avoidance symptom, at least 2 arousal and reactivity, and 2 cognition and mood symptoms for at least a month before you can officially be diagnosed with PTSD. Let's see. Symptoms in children under 6 years old, wetting the bed even after they've been potty trained. Sometimes they'll forget how to talk or are unable to talk. They will replay, the traumatic event during playtime. You often see it a lot with action figures or dolls and things like that. And being unusually clingy with either a parent or an adult or just a particular individual. Symptoms in older children usually look a lot like the adults, but they do have disrespectful, destructive behaviors. Guilt for not preventing the event, or even thoughts of revenge for the event. Let's see, next one. Some of the treatments, the main treatments would be medications and what we call talk therapy. It can be one-on-one group sessions or one-on-one or group sessions. There are several different types of talk therapies that you can be involved in. Treatment is individualized because everybody experiences and handles events, traumatic events differently. So it's going to be really catered to that specific individual. And seeking help from a mental health provider that specializes or has a lot of experience in PTSD is the most ideal provider that you can find. Some of your key components of effective talk therapies would be education about the signs and symptoms, teaching the skills to help identify the triggers of your episodes, and skills to manage the triggers and your symptoms. Some of the common therapies were exposure therapy. That's where you're safely and gradually exposed to the traumatic event. That can be imagining, writing, or actually visiting the location of that event. Another one would be cognitive restructuring. A lot of times you'll see patients that they don't exactly remember the event like it actually happened. It's actually a coping mechanism that your brain does. They remember it, they kind of remember it completely different than the actual true event. So the cognitive reconstruction helps the client make sense of all the bad memories that they may be experiencing from the event. And another thing is like them not remembering it exactly how it was can cause lots of feelings of shame or guilt, and that can lead into other disorders as well. Things you can do to help outside of your seeing a provider or or a therapist would be engaged in mild physical activity or exercise. It can help reduce your stress levels. Whenever you're setting goals, set realistic goals. Take baby steps. Don't start off running when you haven't walked yet, basically. Large tasks can be broken up into smaller tasks so you don't feel overwhelmed. Try to spend time with other people. Socializing has been proven to help people with this disorder a lot. Confide in a trusted friend or family member. Always talk about your emotions, because if you keep them in, you're liable to do more harm than good. Expect gradual improvement rather than immediate. It is a process. It's not something that's going to get better overnight or in a week. Sometimes it can take months. And identify and seek out comforting people, places, or situations.
The next one we're going to talk about is bipolar disorder. Bipolar disorder is a disorder that can affect everyday life. It's a brain disorder that can cause irregular shifts in someone's energy, mood, activity levels, and ability to perform activities in daily living. There are 3 different types of bipolar, and those include bipolar 1, bipolar 2, and cyclothymic disorder. Bipolar 1 is defined by manic episodes that last at least 7 days, or by manic symptoms that are so severe that a person needs immediate hospital care. Usually, depressive episodes occur as well, typically lasting at least 2 weeks. Episodes of depression with mixed features are also possible. Bipolar 2 disorder is defined by a pattern of depressive episodes and hypomanic episodes, but not the full-blown manic episodes described above. And cyclothymic disorder is defined by numerous periods of hypomanic symptoms, as well as numerous periods of depressive symptoms lasting for at least 2 years. However, the symptoms do not meet the diagnostic requirements for a hypomanic episode and a depressive episode. And some symptoms of bipolar disorder are periods of usually intense emotion, changes in sleep patterns and activity levels, unusual behaviors. These certain periods are called mood episodes, and mood episodes are drastically different from the moods and behaviors of what are considered to be normal for that person. And some treatments for bipolar disorder are mood stabilizers, atypical antipsychotics, antidepressants, and talk therapy is recommended for those diagnosed with bipolar disorder.
Right, so what is your plan? How can we help others or loved ones that may suffer from mental health illness? Number 1, get them help. Encourage them and be there for them, even if it's just okay just to talk with them. Sometimes that's all they need is somebody to talk to. Remember that their mental illness is real. It is an illness. It's not a choice. If they could figure out how to fix themselves, they would. Look for support groups in your area. So what do you need to look for in your loved one so you can get them help? You would want to look for some of the symptoms that we've listed, depending on what problem you may think that they have. Are they withdrawn from you? Do they seem sad all the time? Remember that sometimes it's hard to pick up on changes in your loved one's attitudes, but small abnormalities in their personality as well as can be something to look out for. You know them best. So, as a community, we can support those people that suffer from mental illnesses. Some things that we can do is talk about it, break the stigma. A lot of people won't get help just simply because they're embarrassed of it. Realize that it's an illness and it's not a choice. Start a support group at a local community center. Make pamphlets and handouts and flyers. Leave them at schools, local gyms, bathrooms, anywhere that somebody might pick them up. Have guest speakers. Go to local schools and bring awareness to the students. These are all good ideas. And there are some resources here in your community. There's local health facilities, the Arkansas Behavioral Health Agency, the Grace Clinic for Behavioral Health is also an option, and there's these phone numbers and addresses that we can leave for you.
eating disorders resources. A lot of my information I got off of the nationaleatingdisorders.org. And there was a lot of ways to help and ways to see the signs and symptoms in your loved ones on that website. There's this place called Regroup Counseling in Searcy, and I listed their phone number and their website. That's another big resource in the Searcy community. St. Bernard's in Jonesboro has an eating disorder clinic. And then there's the suicide hotline phone number. As far as eating disorders go, your biggest way to help them is to get them these resources, and to recognize whenever someone has an issue, because a lot of times they won't come to talk to you.
And there's our references.
And that's our references. And thank you very much for having us. If you have any questions, now's the time, raise your hand.
No?
No? Okay, thank you. Have a good day. Now don't tell me that it